Recently, a massive global study was published in the Lancet journal. It tracked mental disorders across more than 200 countries from 1990 to 2023. And it found that for the first time in history, mental illness has become the single leading cause of disability worldwide. Not back pain, not heart disease, mental illness. Hello, and welcome to the Dr. Suzette Glasner Podcast. I'm Dr. Suzette Glasner, clinical psychologist and associate professor at UCLA. And today I'm going to cover 4 things in relation to this study. The first is what the study actually found in plain language. Second, what used to be the number one leading cause of disability before mental health took its place, because that context matters. Third, why this is happening, and especially why teenagers are bearing the heaviest burden. And fourth, what clinical behavioral health science tells us about what you can actually do about this. So let's start with the study itself and what it found. So the study is called the Global Burden of Disease Study, and it's a collaboration of thousands of researchers across the world, the most comprehensive tracking of disease and disability. And here's what they found. In 2023, 1.17 billion people, roughly 1 in 7 people, were living with a diagnosable mental health disorder. Now, that number has nearly doubled since 1990, a 95% increase in total number of cases. Now, you might think, well, the world population also grew, which is a fair point. But even after adjusting for population growth and aging, the rate of mental disorders has still increased. The headline finding is this: mental disorders are now the leading cause of what researchers call years lived with disability, or YLDs. And that's really a technical measure of how much disability a condition causes across a population. And for the first time since we've been tracking this, mental illness is number 1 above everything else. Now, which mental illnesses are doing the most damage? It's anxiety, depression, schizophrenia, and eating disorders, all of which have seen significant increases. And of those, anxiety and depression together account for the largest share. Now, one thing worth knowing: substance use disorders were assessed separately in this study, so they're not in these numbers. When you fold them in, the picture unfortunately does get worse because they are deeply intertwined with the mental health crisis and really not separate from it. So now let's look at what was it before. Could you guess? If mental illness is now the number 1 leading cause of disability, what was it before? It was musculoskeletal conditions, and specifically low back pain in the top spot. So low back pain has been the leading or second leading cause of disability in most regions of the world for many decades. We've all experienced it ourselves or in people we love and care about. In some form, it's one of the most common reasons why people miss work, lose function, and require medical care over time. Mental disorders were already number 2 in 1990. They've been closing the gap for 3 decades, and now they have passed it. And this matters for a number of reasons. First of all, it tells us something about how our world has changed. Sedentary, screen-heavy work and life have increased. We've all experienced that. Second, it tells us something about what our healthcare system was built to treat versus what they now need to treat. And there is a gap there. So most healthcare infrastructure, insurance coverage, primary care training of physicians, hospital capacity was really built around physical disease. And mental health care has historically been undertreated, underfunded, and stigmatized. The burden has really shifted, as these data clearly show, and the infrastructure hasn't kept up. Now, third, why is this happening, especially in young people? So here's the part of this that I find quite concerning, and really the most important part for parents, educators, and anyone who works with young people. The increase in mental health burden is not evenly distributed across age groups. The sharpest rise is in adolescents, age 15 to 19. Why? Researchers point to several hypotheses. You can probably guess what some of them are. And we're not settled on this by any means, but all of these hypotheses are grounded in pretty solid and growing bodies of evidence. So the first one, as you might have guessed, is social media and smartphone related. So the timing is striking. The sharpest increases in adolescent anxiety and depression track almost exactly with smartphone adoption. And psychologist Jonathan Haidt, in his widely discussed book, The Anxious Generation, argues that this is not a coincidence. His thesis is that we replaced play-based childhood with phone-based childhood right around 2012, and now we're living with the consequences. So social comparison, cyberbullying, poor sleep, lost in-person connection, especially damaging for young girls. And now not everyone agrees with this as a leading hypothesis, but some researchers argue that the causal evidence doesn't yet support the strength of those claims. But the mechanisms are plausible, and most scientists and clinicians who are working in this space agree that this kind of precautionary principle applies. And this is a good place to look if you know or love an adolescent with mental health concerns, is what is the role of the smartphone and tech in their lives. And I have spoken about this in other recent podcast episodes as far as how to help young kids with addictive behaviors around phones. The second hypothesis is around COVID-19. The pandemic did not directly cause the adolescent mental health crisis. I mean, in some forms, it certainly contributed to it, but it made it a lot worse. So school closures, social isolation, disrupted routines, and the loss of those developmental milestones that matter the most in adolescence and really mostly happen in person. Relationships, identity formation, a sense of belonging with peers, all of this converged during a period of already rising distress. So the data consistently do show that the burden of anxiety and depression among adolescents and young adults accelerated sharply around 2019, which strongly implicates that the pandemic had a role in what we're observing today, and it just has not completely resolved yet. In many ways, it sort of set off a kind of new level of reliance on technology for connection that we really have not gotten away from. Third is what I'd refer to as the sleep crisis. And this one probably doesn't get enough attention. Adolescent sleep has declined significantly over the past 2 decades. And part of that is biological. So there are circadian rhythm shifts in puberty, leading adolescents to go to bed later than they did when they were kids. But device use in bedrooms makes this a lot worse. So sleep deprivation in adolescence is one of the strongest known risk factors for depression, anxiety, and, as I've discussed on other episodes, attentional difficulties, as well as emotional dysregulation. So sleep is super important. And when we talk about teenagers who are suffering more, the answer is partly that they're just running chronically sleep deprived, and that has neurological consequences. The fourth theme is substance use. So we know from longitudinal research studies that early onset substance use, so starting to drink and experiment with or use substance chronically in early adolescence, increases the risk of more severe and treatment-resistant depression and anxiety in adulthood. Not only that, but it also increases the risk of developing an addiction or a substance use disorder. And so for many teens, substance use is happening in the context of untreated mental illness, and then it feeds back and makes the mental illness even worse, and can also become complicated by the development of addictive behaviors, making the mental health issue much more difficult to treat. So now I want to move to what you can actually do about all of this. And I'm going to focus on the diagnoses that are driving the most disability in the 15 to 19 age group, which are anxiety disorders and major depression, and what the research actually supports as far as prevention. So we were just talking about sleep. Sleep is a non-negotiable and more powerful than most parents realize. So the evidence on sleep as a prevention target for adolescent depression and anxiety is among the strongest that we have. The recommendation for teenagers is that they get 8 to 10 hours of sleep per night. So if your teenager is consistently getting less than that, that is a clinical risk factor for emotional difficulties. And one thing we know works is removing phones and devices from the bedroom at a set time. So not in the room, not face down, and your kids are going to try to negotiate their way around this with all of those suggestions, but it actually needs to be out of the room. This is hard and it is worth the fight. So according to a study in 2024, a meta-analysis that combined a lot of different research studies, improving adolescent sleep reduced depressive symptoms with a magnitude that is similar to that of antidepressant medications. So target sleep. Second, physical activity. Exercise is a primary prevention approach for depression and anxiety. And the effect sizes, or the size of the impact of exercise on depressive and anxiety symptoms, is not so different from what we see with antidepressant medication for mild to moderate cases of symptoms. Now, this is a neurochemical kind of phenomenon. We've even seen it in addiction treatment, that when we help people with addiction who are in recovery to structure a program of regular exercise, they show improvements in anxiety and depression, and they demonstrate a reduced likelihood of relapse to drug and alcohol use, just as a result of exercise. For adolescents, the recommendation is 60 minutes of moderate to vigorous physical activity per day. And the barrier to that is really the screens. We've built adolescent life around screens and sedentary activity. So reversing that, again, it takes effort, but it's well worth the effort for the gains that you get in terms of mental health. Third is real in-person social connection. This sounds obvious, but it is being crowded out by the phones. So unstructured time with peers, not on screens, not playing video games together. That can be fun too, but it's not to replace that in-person kind of connection. Just hanging out. So this is a place where adolescents will practice social skills, they process emotions, they develop their identity, and they build the kind of relationships that can serve as buffers to mental health struggles and mental illness. Now, research on social connection consistently shows that it is one of the most powerful protective factors against depression. So the practical implication is really to prioritize in-person, real-world peer relationships and really kind of put that up there in the same kind of priority level as homework or sports practice. It's really important for well-being. And then fourth, as I mentioned, early onset of substance use predicts a lot of problems. It predicts greater risk for developing addiction, greater risk for developing mental health problems, a more difficult time treating mental health problems effectively. So this is probably the least intuitive item on the list of what you could do, but with the knowledge that the adolescent brain is still developing and that early use of substances interferes with the development of the functions that are really important to prevent addiction and help young people learn how to effectively cope with stress and the ups and downs of life, delaying that first exposure to and experimentation with alcohol and substances is one of the best things that you can do for your teenager to the extent that you can have an impact. So in practice, what this really means is having honest conversations with your teen, really starting probably earlier than most parents are comfortable with about why the timing of first use actually really matters as far as the way that it's going to affect them in the long term. And now the research on this is very consistent. Later onset really means better outcomes across the board. And then finally, know the early warning signs of mental health issues in young people and lower your threshold for asking about it. So anxiety and depression look different in young people than they do in adults sometimes. So in teens, depression can look like irritability, can look like anger, can look like withdrawal from people more than sadness and tears and crying. Anxiety can often present as avoidance, so refusing to go to school, backing out of going to activities. Sometimes it becomes more physical, so stomach aches before stressful situations and things like that. If you're a parent or an educator or an adult who works with teenagers, when you notice a change in behavior patterns that seems like it's going on for more than a couple of days, ask directly. So one of the things that adults often fear is that if they're asking about mental health symptoms, and especially if they're asking about suicidal thoughts, that they're going to plant a seed or give a kid an idea that they didn't otherwise have. But the research actually really doesn't support that. It consistently shows that asking a young person if they're struggling, and also asking them directly if they're having thoughts about self-harm, if you're worried about that, does not plant the idea or make things worse. It actually makes things better and opens a door to them receiving the kind of support that they need. So what I'd really like to leave you with is the fact that mental illness is now the leading cause of disability in the world. It's not a reason to despair. It's a reason to take it as seriously as we take everything else in medicine. And if you're watching this because you're worried about someone you love or about yourself, I hope you've learned something valuable that you can use to seek the kind of help and support you need for yourself or your loved one. And I look forward to seeing you next time.